And here I'm going to mention something about the definition of health. There are many definitions out there, okay? But the most commonly and widely perceived and used is this one, which was created and engraved by the WHO ages ago, I think in 1948. This definition is not new. It's an old one. Old means it's around 60, 70 years. Okay. WHO defines health as follows. I mean, if you look at this sentence here, you will see that this sentence has two parts. One of them is the definition, and one of them is stressing another factor, is that usually people, when you ask people like you, or you ask your mother, or you ask your father, your neighbor, anybody in the street, when you tell him or ask him or her, what is health? Many people will answer the following. They will tell you that health is no disease. This is very common. I am healthy, it means I have no disease. WHO wanted to say that this is not correct. We have other things to say. That's why this definition of WHO, which was created in 1948, and still it's used, despite other definitions that came up, still used, it has two parts. One of them, the later part, which is not merely absence of disease or infirmity. Infirmity means unable to do anything. Unable, yes? Infirmity, I cannot do anything, okay? Second one, which means not only the absence of disease, which is the usual answer which people give when you ask them what's health. They tell you, it means no disease. So WHO wanted to say, no, this is not the definition. That's why this came as the second part of this sentence, the definition. The first part is the definition. What is the first part? He's telling us that a human being has nature of three. Physical, the way you look, shape, you have muscles, you are tall, you are short, you are fat, you are thin, the way, physical appearance. And then WHO want to say that also, plus, in addition to this, you have the mental health. Are you okay? Are you cool? Are you nervous? Are you aggressive person? This is the idea. So it's not only the physical appearance, also the way you do things. Some people look very calm. Some people are all the time nervous. Some people have mental disorders, psychosis and schizophrenia and all others. Okay? So very important is to have wellness in physical appearance. You have two hands, two legs, two eyes, nothing is lost. And mental, you cope with life easily, mental health, plus social. What do I mean by social? If I ask you, how many friends do you have? Some people might say, I don't have friends. This should signify something. This should give us an indication, what is this? Somebody who has no friends, although we are 9 billion people on earth, definitely you should have friends. Some people might tell you, I have 10 friends. This also, maybe on the Facebook, you have thousands. Maybe this is all fake, yes? No, you don't know all of them. But definitely you should have friends, socializing. That's why sometimes we call somebody who is educationally almost zero, but he is very intelligent socially. What do I mean intelligent socially? He knows how to deal with people. Exactly. Relationship, as your friend said, relationship. Some people, when you see them and deal with them, they are easygoing. And you have the feeling that you know this person ages ago, although you just met him. And some people, when you sit with him or her, both, yeah, you don't feel you want to continue. Very aggressive, not smiling. This is socializing with people. So you should have a network of people around you. This social relationship, it has many benefits, including protection. They can protect you. If you have many friends and you need help, the friends will come the first. sometimes even faster than your family. That's why WHO says that health is being well, being balanced between these three components: physical, social, and mental. Okay. And not, see that the last word, the last sentence, and not the answer people usually give you, which is health means no disease. This is the definition that WHO uses and many people are using. And this has been created in 1948. Can you imagine? 70 years, 75 years from the time of Nakba. Okay. So these here, the Venn shapes, they tell you that you are a body, you are a mind, you are a health, you are a social, all together. Yeah. One component forms the human being. What does it mean if you are a very beautiful lady and you have a problem in your mentality, or you are a very handsome guy, but socially zero? It happens. Okay, so you need three of them. We are not perfect. Maybe one of them will sometimes, overwhelm the other. Maybe he's physically fit, bodybuilder. His social is okay, not very high. Mentality is okay. So you can never have 100% of the three. This is definitely. This is the definition of health. I think Miss later on, when we talk about definition of public health, health. When we talk about definition of health promotion, you know what health is. Definition of health education, you know what health is. Definition of epidemiology, so health is the base. Okay, let's continue. Okay, if you have any questions, just ask me. Okay, now let's go and see what is public health and how the definition of public health developed over time. Okay, public health, relatively, it's a new subject, a new topic, a new specialty, a new field, public health. And the first definition was set by a guy called Charles Edward Emery Winslow. This guy here, 1923, which means 100 years or 101 years, yeah? He set out and he created this definition. Look at the definition created by Winslow. We call it Winslow's definition. Look, the science and art. At that time, because it's public health, of course, definition of health was not there. The definition which we talked about earlier, it came some 20, 30 years later. Okay? So it's the science and art. Sometimes dealing with people is an art. And getting good marks is an art. So life all is an art. That's why Winslow said it's a science, but also it's an art, because you are dealing with people. And there are ways to deal with people. Yeah? It's of doing what? Art and science of doing what? First, prevent disease. We don't want disease from the first place. That's one. Then, prolong life. At that time, life expectancy, which means how much people in a community live, was very low. In USA, at that time, it was 47, around 50 years old. People used to live in USA 50 years old and then die. So at that time, we were very eager, or they were very eager to prolong life. Okay. And then promote health. Now we have a new subject called health promotion. Health promotion came out in 1986, in the 80s, something which is new also, newer than public health. But as you see here, promote health, which is health promotion, came out from public health itself. Okay, so it's health to promote health. Somebody might ask me, what is health promotion? Well, health promotion is like health education. You educate people, give the people knowledge to try to change their behavior for the good. Health promotion is to empower people, not only educate. Sometimes when you educate, you give knowledge. I keep talking to you. This is knowledge. I'm giving you knowledge. Health promotion is one step ahead. Is that I give you knowledge, and also I make your daily practice, daily life change so that you can control your own health. This is the idea. Health education is I give you knowledge, But health promotion, I make you control your health. This is the idea, okay? So we prevent disease, we prolong life, and we promote health. P, 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 3 Ps, okay? Through what? Organized community efforts. This is not a one-man show. This is not a one-man show. It's a show that everybody has to participate in, okay? That's the idea. So this is Winslow. When you look at it, you see that it's almost complete. I mean, Dr. Winslow, definitely he was a health person, a medical doctor, or like you or something, or a nurse maybe. Yeah. So this is Winslow. Winslow's definition kept there until when? Look, time. This is a timetable. Then, in 1988, meaning that after 60 years, some 60 years later, yes, then another institution, another definition came out from the Institute of Medicine in USA, I think. And here, what did they say? They say it's an organized community effort. They never said it's an individual. Public health, it's not individual. It's not like doctor sitting with me as a patient and then making diagnosis, X-ray, lab, come back again, treatment, capsules, injection, and that's the end of the story. No, here they said it's an organized community effort. It's a community work, but it should be organized. Somebody has to set things down, okay? For what? For prevention of disease. Still, we don't want the disease to come to us from the first place. We don't want disease. So prevent disease. See how much in public health, how much disease prevention is important. Prevent disease. And then still in Winslow back, he said it's prevent disease. It was also the first. Then promote health. Also giving the people the ability to control their health. This is what I mean by health promotion. Giving the people the ability to change their behavior and thus control their health. You have diabetes, I have hypertension. Don't eat carbs. Don't eat salts. I practice this. I am controlling my health. This is health promotion. What is the thing that dropped down from Winslow's definition? Prolonging life. It looks in 1988, the Americans, the Russians, the Chinese, the Arabs, the Africans, they had long life. So it no longer became an ambition, an objective. Okay, this is the idea. So they dropped down the prolonging of life because maybe at that time, life expectancy in the whole world was more than 65, maybe. Yes, nowadays it's 71. Life expectancy now in the world, 71. And in Japan, it's 84. In Japan, many people live 84 years. Okay, so here, developed community, organized community work. No need for prolonging life because we already have long life. Then, after 1988, came the other one, which is this. APHA. What is APHA? American Public Health Association. APHA, by the way, it was established some 200 years ago. See, public health, 200 years ago. APHA. If you go back, I think 18 something. Yeah, I don't remember the exact date, but APHA is not something new. APHA, American Public Health, they have this definition, which is a series of individual and community. It's not only community. Now here they put also weight on the individual work because some doctors, they work alone, private sector. So we cannot ignore them. Some doctors, they are really intelligent and they impact their society. So it's an individual, it's a community, okay? And activities and programs, different activities and programs, working to do what? Again, we don't want prolonging life because life expectancy is already high. So we still emphasize the other two things, which Winslow talked about, which the Institute of Medicine definition talked about, promote health, giving the people the control over their health. This is health promotion. When somebody asks you, what is health promotion? Giving the people, you give them knowledge and you give them the power to control their health. okay? By, for instance, making activities, not smoking, doing this, doing that, okay? So promote health, prevent disease, injury, and premature death. What do I mean by premature death? Maybe suicide. Some people kill themselves when they are still young, or car accidents. This is premature death, dying before time, okay? What is the time of death? It's life expectancy. For instance, in Japan, it's 84. In Germany, 81. In Palestine, 73. In USA, 77 or 78, like this. Of course, there's difference between men and women. Women is usually have 2 or 3 years more. Yes, women live longer. Okay. So premature death, and to ensure conditions in which we all can be safe and healthy. See, safety. They added safety here. Being safe, feeling that you are safe. You're not going to be killed. You're not going to be robbed. There is no war around. Yeah? So safe and healthy. This is the American. These here, if you see, developed through the last 100 years definitions, not very much change. Maybe at the beginning they were very keen on having long life. Now we are not. Although there are some researchers that they want us to live like turtles. You know what a turtle is? What is turtle? Tortoise? Yes, turtle. Turtles live long. Charles Darwin, when he brought the turtle, I don't know what is the name of the turtle, but it was a big giant turtle. He brought it from Galapagos. There's Ecuador, yes, and Ecuador, yes, not Galapagos, yeah, from where he was. And he put it in the London Zoo, and it died just a few years ago. You know, that was 300 years. So they wanted us to live 300 years, yeah, like Noah. Yeah? Anyhow, if you like this. Then finally, there is this definition, which is the 2000 definition, which is the definition our textbook, Riegelman, proposes. Maybe people agree with this or do not agree with this, but it's a nice definition, you know. Sometimes you have people who can create, you know, definitions and create laws, and it's an art also. Look, let's go here. Totality. It means that this definition, which is new, according to the book which you are taught, Public Health 101, yes, totality. What does it mean? Comprehensiveness, overwhelmingness, overwhelming. It's everything, yes, totality of all evidence-based. What do I mean by evidence-based? You have numbers in the middle. Numbers, figures. If I tell you, look, HIV in Egypt is very high. It's still a rumor. You cannot prove this unless you have numbers from the officials in Egypt. Or I tell you, in Greece, they have lots of STDs. In Brazil, they have lots of... You cannot say this unless you have numbers, official numbers from that country, from that health system. I tell you, I agree with you that sometimes some countries, they forge. You know what forge means? They forge numbers. Yes, exactly. They forge numbers. I agree with this. I remember some of the countries I'm not going to mention, they forged how many HIV cases they have politically. But mostly everything is okay. So evidence-based. I cannot say this village has, the people in this village, they have high number of STDs unless I give numbers. Because people can say anything. You can hear every rumor and every gossip. You know what a gossip is? Rumors, people blah, blah, blah. You can hear, no, I need evidence-based. Because based on this evidence-based, I can make programs to help people. Evidence-based, public and private, governmental, NGOs, private doctors. So everybody is taking share. It's not something that the government is doing alone. The government alone, no. Government, private, NGOs, institutions, health research institutions, anything. Okay, it's just the whole society here. Through life cycle to do what? Preserve and promote. So they added the word preserve. So if you have good health, if you're in a good shape, if you're in a good mentality, we should keep it. Maybe you are in a good mentality now, then something happens to your family. Somebody dies, then you lose this. This good mentality, you lose it. So to preserve, which means to maintain what you have. Okay, the positive things. Preserve and promote health. We talked about what health promotion, yeah, and prevent. So again, the three P's came back. Three P's came back. P, P, P. Preserve, promote, prevent. Preserve, promote, prevent. Prevent disease came at the end. Yeah. Preserve, promote, and prevent what? Disease, disability, and death. So you have three P's against three D's. PPP, DDD. Okay, this is the development of the definition of public health from 100 years back until now, 1923 until now. It's 100 or less, more or less. Okay. So this is the idea. Now let's come to things, to changes that led to a new look into public health. We have changes around us that came because of technology, because of new thinking, because this is life. Life doesn't stand still. One fact in life is change. One fact in life is change. And that's why you should all the time adapt and make new things. A technique that might work for you now might not work for you next year. So you all the time have to change. Nothing works forever. Okay, we're not talking about God and God's creation and this stuff. Okay, or let's say holy books or something, which are really something that have never changed since 2,000 years, whether it's Christianity, Islam, or Judaism. Here, everything changes. So prolonging of life with equality. We were talking about prolonging life, and I told you that life expectancy in the world in general is 71. And some countries like Japan, over 80. Germany, over 80. The Israelis even over 80. Palestinians, 73, 74, 75, like this. And so on, from China to India to Brazil to Argentina. Okay? So we care about prolonging life, but also we care about what? The quality of life. What does it mean if you are 84 and you cannot eat? You cannot drink a cup of water? That's a problem. You need prolonging of life. At the same time, you need quality of life. Just to do daily tasks, eating, drinking, going to the bathroom, showering, all of these, talking to people. Okay? Because the more you age, the more deterioration happens to you physically, yes, and mentally, for sure. Okay, so prolonging life with equality. This is something new, a new change. Not prolonging life plus quality of life. Technology. We have now around us technology. See, you are all listening to me, for instance, except him. He's following something. That's technology. I could have say, okay, you give me your mobile and I put it here, and he will lose his mind. He will become, he will lose his tempers. Yeah? Why? Because he is addicted to this. Not only him, all of you, all of us. We are addicted to our mobiles. Many people, when they sit together, they just sit and look in their mobiles. They never talk to themselves. They follow what's going in Ukraine, what's going in Gaza, what's going in China, what's going in Canada. Just life, within minutes, within seconds, you know what's going on. And when we are addicted to technology, new health problems arise, and mainly mental, yes, and also physical. If I keep just staring at my mobile for 24 hours, what happens to my eyes? What happens to my neck? Yeah. So technology, also the development of technology affected health, whether to the good or to the bad. We have two things. We cannot say to the good, we cannot say to the bad, only to both. Third is this, evidence-based. Now people became more aware. If you come and tell me about, what's your name? Abdullah. If you tell me about Abdullah, Abdullah is a good person, so and so and so. But I need evidence. If you go to the news, on the news, in the wars, you see lots of news. Biden said this, Trump said that, yes? Macron said this, Macron said that. No, no, no. Many news are fake. Many news are fake. And in health, you can fake news. You remember the COVID-19? COVID-19? Yes, vaccination, WHO, we all should vaccinate. And now they are telling us that the vaccination was not properly studied, was not properly made. Maybe the vaccine had negative effects, side effects. Maybe this, maybe the vaccine is not effective. And I know many friends, maybe also you know, many friends who had been vaccinated 2 times and still they got COVID-19. So it was not evidence-based. Evidence-based that you know you have numbers in the middle. You gave the vaccine to 100 people and 98 of them, they are protected, they never got COVID-19. That's evidence. You made a study. And on the net, regarding health, you will see all sorts of people coming out in videos on the net, Facebook, Twitter, which means X now, yes? And you say, if you eat this and that, you will become so and so. Don't do this in health. If you drink this tea, for instance, green tea, this will happen to you. Are there any studies? As doctors, you are doctors, you'll be the future doctors. As doctors, never believe these rumors which you hear on the net. YouTube, Facebook, TikTok, and all of these. You need to go for studies. Go to the studies and see what the studies say. And these should be credible studies. This is what I mean evidence-based. Because we have lots of things, lots of medical procedure, lots of health procedure, and we don't know which of them is effective and which of them is just a waste of time, a waste of money, and a waste of effort. So we need research, in other words, evidence-based. We cannot take things for granted unless we see evidence before our eyes. Okay, that's number 3. Number 4, collaboration. We are not going for the medical model. You know what the medical model is? Medical model, patient comes to you as a doctor, and I have headache, I have this, I have that, just narrates all the symptoms he or she has. And then you start thinking as a doctor, and then, okay, do these tests for me. CBC, LDL, HDL, cholesterol, and make also measure your blood pressure. Please do this X-ray, please do that, do this, and so on. And then it comes back, and then this is the tablet. We give you this, we give you paracetamol, we give you Advil, yeah. This is medical model. Nowadays, this is not enough. As a doctor, this is not enough. Also, you need to have this medical care or clinical care. You need to have education, health promotion with it, especially if you are diabetician. You're a doctor who's specialized in diabetes. Your medical intervention will be very small. Most of what you are going to have is health promotion, most of it. Okay, so now we don't believe in medical model alone. We believe in medical model and public health model, or health model, or health promotion model, whatever you want to call it. Okay, so public health and together. A doctor who focuses only on the medical model will not be, maybe he can get lots of money if he's good. Lots of money, yes, become rich, but not more. Okay, then social system. What do I mean by social system with public health? Many times, let's say you are fat, obese. Then maybe they can give you, they can just make a surgery and, you know, and then minimize the amount of food you eat. Maybe they can give you some drugs, but mostly they will do what? They will ask you to go to the gym. They will ask you to go to the club. These are institutions. They are not health institutions. Is the gym health institution? No. But these institutions, they are not health nature, but they help health. Yes? So you can go to a club, you can go to even the poor people. They can go to social ministry. You know the social ministry of welfare, Ministry of Welfare. It's a ministry that is responsible for giving money to the poor. Yes, so if you give the poor people some money, at least you will maintain their good health if they are in good shape. So we have many institutions that are non-health institutions, but they play a role in health of the human, like gyms, institutions, clubs, ministries of health, welfare, parks, the parks in the city. All of these, they are institutions, but they are not health institutions, but they play a role. So we call it social system. Social system supports health system. Okay. So it's not only we go to a hospital. I can tell you go to the gym so that you can become less obese. You can become in shape. Yeah. And yes, this is the idea. And then finally, what we have, these are the changes. Elderly. Many times during the 90s, I remember 90s and 2000s, and we were running what we call MCH clinic. What is MCH? Mother and Child Healthcare, or maternal. So we used to care for the mothers and the children. Children and mothers, mothers and children. We had a mobile clinic and that went to the mountains, and we provided drugs, we provided healthcare, medical intervention to mothers, young mothers and their children. Nowadays, with life expectancy going sky high, 84 in some countries, 70 in most countries. In the world, it's 71, as I said before. We are having a new people. We have a new section of people who are the elderly. We are having old people. Who's going to work for these old people? Who's going to give them money? Who's going to serve them? We have a new thing, which is old people or elderly care. Geriatrics. You know what geriatrics is? Geriatrics is it's a specialty like oncologist, orthopedist, pediatrician. You have geriatrician, doctor who is just specialized in old people. So we have elderly people in Japan. I mean, these elderly people, they were workers like us and like you. They were students like you one day, and then they became workers and they worked for the country until they became 60 or 65 or 70, and they went to pension. You know what pension is? Stop working and then at home. These people served the community. Now it's the time to pay them back. What do I mean to pay them back? To give them the respect and the payment, because they one day in the 70s and the 80s and the 90s, they served the community. So it's time for us, me and you, as young people, to work and give money to these old people. So we have a new thing, which is elderly, taking care of the elderly. These are all 6 changes that dictated a new way of looking at health, new way of looking at health. So these are the changes. Let's go to something we call, this is what I talked about, again to the definition. This is the definition of public health according to Riegelman, according to the textbook which we are using. Yes, Public Health 101. PPP, DDD. I like to use mnemonics. What is mnemonic? What's a mnemonic? Anybody? Good. Good. Yes, that's a mnemonic. Starts with M, by the way. It's not N, N, MN, I think. I think so. Go back and check. So it's a mnemonic. I like mnemonics. Why? Because they make things easy to memorize and very quick. So when somebody asks you, what is public health? Very quick, you have to remember what? The 3 Ps and the 3 Ds. Preserve, promote, prevent. Preserve, promote, prevent. What? DDD. Death, disease, disability. Of course, we talked about totality, comprehensiveness, overwhelming look. We talked about evidence-based numbers. Don't listen to people what they are saying. I mean, listen to them and show them that you are convinced with what they say, but go back and check what they are saying is correct scientifically. I mean, people, we don't say they are liars, no. But as a scientist with critical thinking and evidence-based thinking, go back and read. If you drink maramia, this will happen. If you drink mint, that will happen. If you drink green tea, this will happen. No. If there is no study about this, I don't believe, because people want to have more views and more likes. Yeah. Sometimes, sometimes people make dangerous things to have more likes. Sometimes people make mock of themselves. You know what mock? Mock of themselves or mock of their, what is it? Exactly. Or their mothers or the grandmothers, just to get more likes. So, and don't be surprised if people lie about health to have more likes on the net or on the social media. So be an evidence-based, be a person who has critical thinking, checking everything. Maybe not in front of people. You don't have to say to the people you are liars. It's bad manners, but go back and check. Okay. Private, yes, public and private, preserve, promote, prevent disease, disability, and death. This is just, again, going back to the definition. Now we have what we call, okay, look, this is public health timeline, figures and events. I mean, look, there are many people who contributed to health. If you go back to the oldest script, we have in our hands, which talked about health, we can go to Hammurabi. You know Hammurabi? Anybody knows Hammurabi? Yeah. Babylon in Iraq, Mesopotamia in Iraq now, near Baghdad and Mosul and Basra. There was Hammurabi. Hammurabi was around 1800 BC. 2000, which means he's around more than 3,000 years. I'm not good at history. More than 3,000 years, Hammurabi in his commandments, which he believed he got from God, he talked about health. And he said, Hammurabi, 3,000 years old, he said that you as a person must pay the doctor his fees 3,000 years ago. And he said that you have to respect the doctor 3,000 years ago. Hammurabi, that's the oldest script we have. Then we have Hippocrates. He's a Greek, and he had what we call the oath. When you finished as doctors, because you are MD students, you finish, there is what we call the Hippocratic oath. What is oath? Oath? Exactly. Very good. What's your name? Jubran is good in English. Yeah. Well done, Jubran. Okay. So the Hippocratic oath, when you finish 6 years, you stand, I swear to help people, I swear to help. Yeah, that's oath. The Hippocratic oath. Because of this guy, Hippocrates is Greek guy, he's Greek. He cared about sanitation. He cared about public health. What else? We have Ibn Sina. Look, in the book, in the Western books, like the one we are using, Public Health 101, they all the time mention that health is only a Western commodity. They have to excuse me for saying this. Health is a Western commodity. What is commodity? Commodity, something you sell and buy. They say it's a Western commodity. I disagree with this. In the book, they give you all the people, all the figures which contributed, we don't deny this, which contributed to health, and we don't deny this. But also there are other domains in the world that contributed to health. For example, the Chinese. They never mentioned anything about the Chinese, although they have their own health. They have their own medicine, traditional healing, acupuncture, all of these Chinese. You have the Indians, another domain. They contributed. You have the Arabs, Ibn Sina, Averroes, Zahrawi, Abu Bakr al-Hawi, Abu Bakr al-Razi, al-Hawi, which is a book for al-Razi. Also, the Arabs and the Islamic era, they contributed very much to the health, and they passed it to the Western civilization. We have also the Africans. The Africans, they have their own say in health. The Africans are not zero. Let's say South America, the Inca, the Maya, these civilizations, also they have something about health. So health is something global, universal. It's not only Western, it's not only in Europe, okay? We don't deny that Europe now is taking the lead, but also other civilizations, they participated, and significantly, to health. So that's why I added Ibn Sina. Ibn Sina is not in the book, Avicenna. Ibn Sina, he's an Islamic doctor, and he has a very famous book, Al-Qanun fi al-Tib, Ibn Sina. Ibn Sina talked about quarantine and talked about control. And Ibn Sina, in one of his books, he said that leishmaniasis, skin disease in tropical areas, might be transmitted by a mosquito, which later on it was found that it's by sandfly. So Ibn Sina had contribution, and I can mention many of them, as I told you, many other Arabic and Muslim cutters. Ibn Sina was from Bukhara, I think, which is somehow were in Iran or Afghanistan, but all of them wrote in Arabic because at that time it was the Arab civilization. Okay, and Maimonides, Ibn Maymun, he's a Jew, and he wrote everything in Arabic. He was a doctor. I think he was a doctor for Salah ad-Din. You know Salah ad-Din Ayyubi, Saladin, King Richard. His doctor was, I think it was Maimonides, Ibn Maymun. Okay, so that Ibn Sina. So please, men, you have to remember that health is a global issue. And everybody, every domain, every civilization has to communicate with this. And saying that the Arabs alone or the Western alone or the Chinese alone made the big contribution, it's away from true thing. Then who's here? Edward Jenner, vaccination. You know, VACA. Edward Jenner, cowpox against smallpox. Edward Jenner was an English, UK, an English doctor who was, one day they had smallpox, and smallpox is a killer disease. We don't have it anymore. We don't have smallpox anymore. And at that time, when smallpox came to a village or a city, it wiped most of the population. It killed most of the population. What Edward Jenner realized or noticed is that there is another variant of smallpox. We call it cowpox, which is not killer. It's a disease that is self-limited. And he found that the ladies who were milkmaids, you know milkmaids? Lady coming to the cow and milking the cow. We would call them milkmaids. Those milkmaids, when smallpox came, they were never affected at all. Everybody died, but they're still alive. And then he said that we can take something, because they used to have some blisters on their hands. He took part of this blister. At that time, they didn't know anything about virus, because this is a viral disease. And he put it inside a small boy, child. The child had fever for 3-4 days, feeling unwell for 1 week, and then went back to normal, because it's cowpox, it's not killer. It's a mild disease. And when the smallpox came, this child did not die. So this is vaccination. That's why the word vaccination came originally from the word vaca. What is vaca? Cow. Cowpox. Vaca. Now we call it vaccination. Edward Jenner. If you ask a Chinese, he will tell you, we used to know this 2,000 years ago, but it's known now Edward Jenner is the father of vaccination, because it was the first report, or the Western say this. But if you go to the Chinese, they will tell you we used to practice this. So please, everybody in the world practiced or had a contribution to him. Then what do we have next? We had this. Jon Snow, cholera. Jon Snow, cholera. There was cholera in London in 1854 on the 18th, in the second half of the 18th century, 19th century. And this cholera killed many people in London. And this guy, Jon Snow, who is known as father of epidemiology, he led an investigation to see what is the cause of this cholera epidemic in that area. And there was a big row, a big fight, scientific fight, not a fight, real fight, scientific fight between Jon Snow and I think a guy, also a doctor called Dr. Farr, I think, F-A-R-R, I think so, as far as I remember. And Dr. Farr said it was something coming from a cloud, let's say poisonous cloud or dirty cloud or a contamination cloud that came to the people and caused the disease. Jon Snow said no, it was something from the water, because London has a river in the middle, the River Thames in the middle of the London, and it was coming from that pump. You know, there was pump from the river to the houses for people to drink. And there was 2 pumps, one here and one here. The one that was close to the source of contamination, what did Jon Snow do? He closed it. And later on, after a week, 2, a month, he found that the number of cholera cases was dropped down significantly. So What Jon Snow did, it was regarded as the first epidemiological reasoning or thinking. Okay, so Jon Snow is called the father of epidemiology, as Edward Jenner, the father of vaccination, and Ibn Sina and Hippocrates. So we had many people. Maybe we can have the other one and then finish the next one, and then we finish. Okay. Come on. Yes. Ignaz Semmelweis, Louis Pasteur, Robert Koch, and Goldberger. These here, Ignaz Semmelweis hand washing. Very quick. The story goes like this. This guy, doctor, his name is Ignaz Semmelweis from Switzerland, 1846. He saw or he found that there was a delivery room. You know what delivery room? For people, for ladies to give birth. And every time the doctors went to the delivery room, 1 week later, the lady dies. And every time the nurses go to help the ladies to deliver, the lady survives. Why? He found out that the doctors, when they came to help the lady deliver, they came from the biopsy room. You know the biopsy room, dissection biopsy room, which means their hands were contaminated. And they were playing with corpses, and they never washed their hands, and they came, and all the bacteria in the lady, and the lady dies. And he said that you have to wash your hands before helping. Nobody believed him. And he died. And later on, after 50 years, they say this guy was correct. They never listened to him. He died without this thing. Then Louis Pasteur, French guy. This is Swiss. This is French. Pasteurization. Until now, the process of decontamination of milk, wine, mainly milk, pasteurized milk. You see on the bottles, pasteurized milk, pasteurized after Pasteur. At the beginning, it was wine. You know wine? Drinking wine. So, and all the wine industry suffered a big knock. They had to get rid of all the wine. Then Pasteur came and said, just boil it for 1 minute. Boil it for 1 minute, and everything will be good. Okay. And that's what happened. And he was also interested in rabies, anthrax, and he's the guy who invented germ theory. And he said that those diseases which you see are caused by very small, tiny creatures which we don't see. Germ theory, this guy. Then Robert Koch, he's a German, and he won Nobel Prize in 1905. And he was a guy who studied tuberculosis, tuberculosis, cholera, anthrax, and bacterial culture. And then Goldberger, pellagra. It's a disease, systemic disease due to vitamin B6 deficiency. It's not B6. I think it's niacin. It's B3. I think the book made a mistake here. It's B3, niacin. Okay, and it was important. People thought it was a disease, genetics, a disease caused by the virus, a bacteria. But Joseph Goldberger said it's vitamin deficiency, B3, not B6. Okay. Yes, you can. Yes, you can. So you have Ignaz Semmelweis, Louis Pasteur, Robert Koch, Joseph Goldberger, and those before. But as I told you, I wish I knew doctors from China who contributed. I would have added them. I wish I knew doctors from India, African, the other domains, so that I can convey the message to you as students that health is something, it's a global commodity that everybody participated in. All civilization did. All civilized, the pharaohs did. The pharaohs in Egypt did also. Okay, I think we can stop here for today, and remind me that we stopped here so that next time we continue to slide 14. Any questions before you go? See you next time. Have a nice time.